Good morning. The National Newspaper Publishers Association and Black Press USA is proud to welcome Dr. Regina Benjamin, who is the founder and CEO of the Bayou Clinic. She was also the 18th United States Surgeon General. As America's doctor, Dr. Benjamin provided the public with the best scientific information available on how to improve their health and the health of the nation. Dr. Benjamin also oversaw the operational command of 6,500 uniformed public health officers who serve in locations around the world to promote and protect the health of the American people. Dr. Benjamin specializes in prevention policies and health promotion among individuals as well as large populations, especially concerning obesity, childhood obesity, and children's health. She has special interest in healthcare, health disparities among socioeconomic groups, suicide, violence, and mental health. Dr. Benjamin is now advising Zillow, the largest portfolio of real estate brands on mobile and the web, on its Move Forward, Stay Safe initiative, which includes health safety standards and the use of virtual technology designed to protect customers. Welcome, Dr. Benjamin.
Good morning, or hello, I should say. Hi.
And also joining us, of course, is our president and CEO of the National Newspaper Publishers Association, Dr. Benjamin Chavis Jr. Dr. Chavis, I'm sure you are thrilled to have Dr. Benjamin with us.
We're so very pleased. And Dr. Benjamin is also a part of our NNPA Coronavirus Task Force and distinguished leader, not only in the medical field. But I think the first question, Dr. Benjamin, is that you're working with Zillow, one of the leading real estate conglomerates companies in the world. Tell us about the intersection between making health safety measures, healthcare in the context of this coronavirus. How's your work with Zillow going?
It's going very well. I guess I need to start by just talking about the fact that when people think of the United States Surgeon General, what the Surgeon General is, because people don't really know, but you think of the image that you see on the cigarette package that comes to mind. While that's really one of the things that the Surgeon General does, the other role is as America's doctor. And as America's doctor, we give the best information available in science to the American people so that they can make good, healthy decisions and healthy choices. And so when I was Surgeon General, my whole emphasis was always on prevention. And if you recall, we released the National Prevention Strategy.
Yes.
And the National Prevention Strategy is a roadmap for a healthier and fit and more fit nation. And so prevention and public health is the foundation of everything I do. So when COVID started, I was approached by the folks at Zillow, and one of the things that we do in the National Prevention Strategy is to talk about healthy homes and safe living spaces. And so this was a way to continue the National Prevention Strategy to help Americans stay healthy and be healthy, particularly in a time like COVID. And so I was really eager and happy to see a company that was interested in not just its employees and its customers, but the health of everyone. And so I was really pleased to team up with them, particularly around moving in safely, developing protocols, things that we could do to make sure that the employees and the customers and their could move forward safely.
Absolutely. And speaking of Move Forward and the Stay Safe initiative, what are other things, particularly as it pertains to Black America? Because I know Zillow recently put out a study that showed that actually there's been some positive things that is happening in the rental and the homeowners space for African Americans.
Very true. You know, with the social determinants of health is one of the major things that we all know about, and we want to eliminate those health disparities that are present. One of the social determinants, and it's in one of our Surgeon General's report, is around housing and safe housing. And so it's a basic skill. It's a basic thing that everyone wants, to have a healthy and safe home. And it's a major one of the social determinants. And shelter and a healthy home is a, excuse me, a basic, essential thing that we all strive for. And so when you look at the housing, Zillow did a study to show that many, particularly African Americans, are starting to be able to move into homes. And one of the reasons you're moving into homes is you're finding that you can work from home. And when you can work from home, you need more space, you need a quieter place, you're spending more time at home, and telework and conferencing is allowing people to work from their homes. And so you're starting to see people want to move into the from rental to buying homes, and you're seeing that movement. We're seeing quite the opposite when it comes to commercial properties, but for Zillow is in the home, in the housing for consumers and homeowners. And so you're seeing homeowners want to put more time and energy into their homes, and that certainly makes sense. And the other thing, as far as social determinants, one of the social determinants is financial stability, and making sure that you're creating a solid financial place. And housing and a home ownership is one of those things that we do to build our wealth and build up our basic things that we want to have, our financial stability, and something that we can leave to our children, those sort of things. And so all of that came into play when we are able to move. And we wanted people to be able to move, but to move safely, and not to put themselves at risk going out trying to, view various homes and various properties and things.
Right. Dr. Benjamin, given the disproportionate negative impact that the coronavirus has had on Black America, how has the pandemic specifically impacted African Americans either trying to get a home or trying to rent a place? Just an overview, how's the pandemic impacted particularly African Americans in the real estate situation?
Well, particularly like anyone, you want people to stay safe. And so I'm going to always say, and I'm going to keep drilling it in, to do the 3 W's. Wear your mask, wash your hands, and watch your distance. You got to do those 3 W's. So when you want to go buy a house, Zillow was one of the leaders into doing virtual tours. And now they have these 3D tours and virtual tours, a virtual tour that you can do with an agent. And the agent can be touring the home, showing it to you, and you're talking to the agent from the safety of your home and not exposing yourself. So they moved up a lot of that virtual abilities. You can even close your documents now using e-signatures. Those things are safe, keeping you at a distance and keeping you safe. Many people will want to go and get their view their homes virtually to screen them, and then once they're ready to buy a home, they may want to at that point go and physically visit the home. But you've been able to screen lots of homes in a safe manner.
Yeah, and Dr. Benjamin, thank you for that. I do want to just go off that topic for one second, and we want to go back to the great work you're doing with Zillow. But David Youngblood, who watches our program very often, he asks a question that's on the minds of many in the African American community, and perhaps you can shed a little light on this. How do we overcome the reluctance, with good reason, of Black people to take the vaccine?
So let's talk about COVID itself. And so in general, it has disproportionately affected us. And we all know that we got sicker faster and die more often. And much of that was related to the social determinants of health. It wasn't related to genetics or any of that. It's really our social determinants, our surroundings. And so we need to work on a lot of that. Many of our community are essential workers, and they're on the front lines, and so they don't have lots of options. And so we've been all summer long, all the last 9 months trying to ask people, please wear your mask, please protect those essential workers. And some are, and some aren't. The vaccine is a ray of hope for all of us when it's available, and hopefully it'll be available to the essential workers early on and be one of the earlier phases of folks. There is, as you know, and all of us know, there is a question about, is it safe? Can I trust it? And my answer is going to be that we in the scientific community, particularly in the public health community, are looking at the information very, very seriously. We're looking at it very closely. And once we know that it's safe and we can look at those studies in various groups and make sure that they're safe. If we come out and say, yes, it's safe, then it's safe. We're close to it already, and there's no reason to think it's not going to be, but we want to verify. And so once we are, and you'll probably be within the next few days, you'll see that. But once we know it's safe, then it's good to take it. And I would recommend that we do, because you need that protection, and you need that protection for you and for your family, and frankly, to get our country back open and all the things that go along with it. But we want to make sure it's safe, and we want to make sure when we say it to you that you can believe it. And we're very close to that now. I'd say we're 90%, 99, almost ready to say that. But once we know, we'll make that determination and say, yes, it's safe. And there are different vaccines. So each vaccine has to go through the same scrutiny and that sort of thing.
Yes.
One of the things, we represent the Black press. We're the trusted voice of Black America. And I was pleased to learn, Dr. Benjamin, I'm sure you know, that there were a number of distinguished infectious disease experts who are African Americans.
Yes.
Who work for the CDC, who work for NIH. Everybody sees Dr. Fauci on TV, but behind the scenes, there are a lot of African Americans involved in determining the safety of the vaccine. And even those, I've been up to the Pfizer company, and I've seen African Americans also working with Pfizer to help develop the vaccine. So I think that the question was overcoming the reluctance. I think if more of our brothers and sisters in the communities that we serve knew that there were many African Americans involved in the process of creating the vaccine, determining the vaccine, the clinical trials, and now the distribution of the vaccine, I think that would add to their confidence that it's safety.
I think you're absolutely correct in that, and I'm glad you mentioned those, because that's all very true. And the people at the CDC, and many of those were my officers, and at the FDA are there. They're
Yes.
Scientists, and they're based on science, and you didn't hear much from them, but they're having their heads down, working really hard on our behalves to make sure that these things are being done. And you're right, many of them are African Americans, and many of them are in key positions of doing it, and even in developing the vaccine. We also have groups that are out there monitoring, watching, that are outside of government, that are in the universities and the academic centers that are making sure that these are verified. And many of those are prominent African American scientists that are there, and health professionals, particularly around doctors and public health officers that are there to make sure that what we tell you is correct, and that it is believable, trusted, and that you'll see us take it ourselves, then it's solid. And what we need from you as the African American press particularly is to help us get those messages out. But we need to make sure they're absolutely correct once we do them. And we're getting there. We're pretty close. As I say, we're pretty close. And when you print that it's safe, then you will know that it's safe. It's not possibly safe. Now, nothing's going to be 100%, and we know that. But as safe as we can get it to be. So.
Yeah, and to that point, Dr. Benjamin, we heard that former President Barack Obama is going to take the vaccine, and he's even offered to do it on television. And speaking of the National Newspaper Publishers Association's Coronavirus Task Force, Dr. Ebony Hilton at the University of Virginia is also taking the vaccine. She's one of those phase 1 individuals as a physician, and she's doing it also on YouTube, and she's promised also to continually update, no holds barred, she said, the condition throughout the whole process. So these are African Americans, prominent African Americans, that are willing to do this, to try and get the confidence of Black America. We know the history, right, Dr. Benjamin? Everyone talks about the Tuskegee Experiment and others that have gone awry. So to the point of some of our viewers right now, perhaps you can address, again, their reticence to take the vaccine.
So I can just speak a minute about the Tuskegee experiments. It's very personal for me, for various levels. My stepmother, who's now in her 80s, her father was one of the men that was being experimented on. And so she said, as they were growing up, they'd have to get their blood tests, they'd do other things all while she was growing up. So it's very personal. In addition to that, it was the public health service who did these experiments. And as Surgeon General, I ran the public health service. In Alabama, it was the Board of Censors, which I became president of that. We have been making sure that this would never happen. And President Obama promised that this would never, ever happen. President Clinton did an apology. And so every eye is on this to make sure that these type of atrocities don't ever happen to our people again. And so we're looking very, very closely. And so you can believe we're not going to let anything like that happen under our watch anyway. So
very good. Thank God that you were the Surgeon General, and thank God that you're still on the case. And I'm really, I just want to say I'm thankful. Even this program, we're getting a lot of questions and observers. Millions of people will see this program, Dr. Benjamin, and we thank Zillow for helping to sponsor, so we could have people around the country to hear from you directly. I think your words, your experience, your reflections, and even now you've shared on the record that a member of your family was involved in the Tuskegee experiment. But to me, we learn from history. We don't have to repeat history. Right. And I think the learning from what happened in Tuskegee is that the government, as well as any medical authorities and scientific, have to always work to make sure that nothing like that ever happens again, but also that we learn from it. I think out of every tragedy, we learn something about humanity. We learn something about out of an injustice, we learn how to do justice. Out of something that's unfair, we learn how to be fair. So I think that what we are facing now with the coronavirus has been very devastating, and all these pre-existing conditions. Can you mention something about the importance of us just having good health, and tie that in with this program that Zillow has now about home safety and the intersection of watching out for your health? Say that if it was no coronavirus, we still need to pay attention to these pre-existing conditions: heart disease, diabetes, asthma, etc.
That's exactly right. And it sounds like a little feedback, but you're exactly right. We have to do the things to keep ourselves healthy. When we talk about prevention, making sure we exercise, that we eat right, that we keep our blood pressures under control, we watch our diets, that we keep down our stress. Your mental health is so important. And if one of the things you and I are part of is American Heart Association. We're constantly asking people to do these things to make sure you stay healthy, because you're much more resilient when you're healthy, and you can fight and overcome any kind of condition better if you're healthier. So it's important that we do that. But it's also important that we as a group make sure we maintain our health. and that we look out for each other. You need to do things, when I say about mental health, if you're feeling depressed or sad, call a friend. And if that friend doesn't answer, call another friend, but don't try to go it alone. Also, just do things that are fun and making you happy. We're a happy social people, find new ways to do these things. But those are very, very important. And it's important that we take care of ourselves, and we can do that, and we have been doing that. But
I'm sorry, Dr. Benjamin, I didn't know you. I
was just thinking about something. I want to go back to a little bit about the fear and the mistrust. That's part of the vaccines, but there's another part of vaccines that I don't want to overlook, and that is the supply chain is questionable. It's going to be a limited amount, and I want to make sure that we watch and make sure that we have the access for those who are willing to take it and want to take it, that they can get it. That is not just going to wealthy groups or certain groups, that we can get it when it's available, because there will be a shortage initially, and that we make sure we watch and make sure it's given out equitably and fairly.
Yeah, and to that point, 20 million, it's expected that 20 million vaccines will be available this month. The Biden administration has promised another 100 million by the spring anyway. We'll see how that plays out. But
those are good numbers, but we have 330 million Americans, and everyone has to take 2 vaccines. So we're talking 660 million. And 20 is going to be a small amount.
Yeah, and unfortunately, we know too through our own reporting and other reports that the current administration did turn down an opportunity to have enough vaccine, or at least much more than what is now available. Unfortunately, that is the case. But I want to go back to the Move Forward, Stay Safe initiative. Zillow is really doing a fantastic job. Now, we do have a short video we want to show our viewers from Zillow that we think can further inform them on this initiative. And of course, Dr. Benjamin can fill us in on some more. So let's take a brief moment and look at that video. So, Dr. Benjamin, what does a healthy home mean to you as a physician?
Well, I want patients to be healthy all the time. But again, on that video, you can see it's a happy family. Some of the protocols at Zillow is that before you even go into visit a home, like a virtual tour, you're asked to fill out a questionnaire to make sure that you haven't had any symptoms, that you haven't been exposed. And so we do some screening ahead of time, and then afterwards there is disinfectants and things that are done. So knowing that you're going into a safe place is comforting to the buyer. You can also sell your home through Zillow. It's not just buying, but you can sell it, and they'll sell it for you, and you don't have to be there to be selling. So those things keep people safe. But the other part is that, again, having that healthy home is a basic need that people food, shelter, safety. Those are basic needs for the humans. And so, and particularly when we talk about social determinants, we want to have a safe and healthy home, and not just buying the home, but you want to make sure you don't have any rugs that you're going to slip and fall, particularly in the middle of the night for older people, that you don't have asbestos, that you don't have, that home needs to be a safe place when you go there. It's your haven. It's your mental place that you feel comfortable and safe. And so, yeah.
Yeah, and David Youngblood, I want to bring up his question again because it's important. We know that everyone talks about a potentially new normal. Well, David asked, does Zillow expect these changes to be the model for home purchases in the future?
So yes, and they've been moving towards that, and I think people are very comfortable with that. You know, rather than setting up an appointment with a realtor, going around town looking at various different houses, I get to screen them myself. I mean, so that's a new normal, and I think the way to um, just to say how things are changing, not just in housing, but we're doing the same thing in medicine. We're doing telemedicine visits, and particularly with my older patients, they don't want to go back to just only in-person visits. In-person visits will always be there, but there's some certain things like my lab results, little things that I can do that they want to do on the phone. They say, I want to do it on the phone. I don't want to have to come all the way into the office. And so I think it's a mixture. It's going to be a little bit of both, and we'll see that as we go forward. And we'll use these things, this technology, as a way to make our lives easier, and we can spend more time doing things we have fun doing, enjoying.
Yeah, Ada Phillips says Zillow is on top of the game. She, one of our viewers, and it certainly seems that way. But I want to go back now. I mean, I think that the important conversation that Dr. Chavis and yourself, Dr. Benjamin, were having about the vaccine, the impact of COVID-19 on Black America, home safety and health. It's a huge issue. We know, that old saying that we hear all the time, that when America gets a cold, Black people get pneumonia.
Yeah.
We have to protect ourselves, right, Dr. Benjamin? But what are some of the things that we might overlook? Maybe a small thing that we are overlooking, even if we're wearing masks, if we're wearing appropriate gear.
You know, you got to wear the mask properly. People, you'll see them, the mask down too far, only covering your mouth. Well, you breathe through your nose, so you want to make sure you wear it properly. People often will ask, well, what if I'm outside? Well, outside helps, but this is airborne. And so being airborne is like when somebody comes up and has a bad cologne, a bad perfume, you smell it. When they leave, you still smell it. And the virus is the same way. When you leave, it's still there. So the more air you get to, you can push it away. But it's that sort of thing. When we say it's airborne, it's not like it just dropped on the counter and it's just there. It's in the air. So you want to get as much airflow as you can, stay your distance, that sort of thing. And wearing a scarf around some bad cologne kind of helps the smell, right? Same.
We were the first, the Black press in America were the first to announce that the coronavirus was airborne. This is back in late February, March. It was a debate. People weren't taking it as serious as they take it now. It's just so unfortunate. And that's why programs like today's program is so important. You are a trusted source of truth, Dr. Benjamin. We really appreciate you. And I know we have limited time for this interview, but I would hope that we find a way how to work with you and with Zillow. And just let me ask you specifically, how can the Black press help you, Dr. Benjamin, the work you're doing with the National Heart Association, the work you're doing with Zillow? How can we work to get this information out more consistently going forward in the real estate field, but also in other sectors?
So the things you're doing already, being available, making information available with Zillow, for example, they have been sharing all of this information with other people in their industry, in the real estate industry, and holding groups together to talk about that others can do it. They're not just doing it for themselves. So getting those words out. With the American Heart Association, we just had this report out on structural racism and the effects on health. Maybe we should do a talk about that if you haven't done much on that, because it really is a good report on structural racism and its effects on today's health. And in a scientific way, in a logical way. It's not just a fly by night thing. These are pulled together. So just getting that information is power, and we know that, and people try to tell us it's not, but it's power. And you being the press is our voice. When you ask a question, you're asking on American people's behalf. And if somebody doesn't give you the answers, that means they don't want to give us the answers. So
Exactly.
whatever you can do to keep getting these messages out and being strict, fair, not biased, just, we're smart people, give us the facts, and many of us got a little bit of common sense. And that's one of the things we do have. Just give us the facts and as they are. And certainly that's what we need.
Yeah. And Dr. Benjamin, as a doctor, as an accomplished doctor at that, you've probably seen thousands upon thousands of patients. And I know that patients can sometimes be very stubborn. I'm a stubborn patient. But when you see 280,000 deaths, 15 million plus with the virus in America alone, and you have the stubborn people still saying, hey, I'm not going to get it, or hey, it's just like the flu or cold, it'll go away. How do you get a message across to them?
We just keep trying to beat the drum, asking people like you and the Black press to just help us continue. And yesterday, 3,000 people died.
That's right.
That was 10 747s going down. 10 would have been crashing and every soul on there died. And we're going to see the same thing today. We're going to see it tomorrow. And yet you think we want to stop it. And if something as simple as a little mask would stop it, why are we not? And if there are people who don't believe it and think it's, whatever reason they don't want to, we take care of ourselves and make sure that you do your part, because we are more likely to die, not just to get it, but to die. And your family member, and you will never forgive yourself if you take something home and your auntie, your grandma, whatever dies because you took it home to them. And I've had to go through that with family after family, and they're devastated. They don't get over that. So.
Yeah,
absolutely. But we're hearing during the program, we have 230 African American owned newspapers that are part of the NMPA network. And a lot of them are sending in messages this morning, Dr. Ben. They want to make sure they're going to play this program on their websites. And so we are live right now, but we're also going to repeat this program. And we're going to leave it up on Black Press USA for not only several weeks, but for months, because the truth of what you are speaking today is so vital. Also, it's also encouraging that we have distinguished medical physicians and authorities like you that not only have the facts, but are sharing the facts in a way that we can better inform our community. Because a lot of times we suffer from the lack of knowledge, the lack of information. And sometimes the information we get is late, or sometimes the information we get, particularly on social media, is inaccurate. Can you speak about where are some of the more accurate places we can find facts so people who are on social media will know what websites to go to? In terms of Zillow, the home safety campaign, is there a particular website that people can go to get the correct information?
Yeah, zillowcom, and you can just Google Zillow and it'll take you right there. So they're big enough to do that. So and they have very good information there. The American Heart Association has a tremendous amount of very scientifically researched information. The National Institutes of Health and the National Library of Medicine has information. There are a number of groups there. The Black press is one way that oftentimes we don't see a lot of this conspiracy stuff in the National Black Press. So those are places to follow. Most of the universities and academic health centers are reliable, and you can follow those. Morehouse School of Medicine has the Satcher Institute of Health Disparities. I mean, we have a number of places you can go to get reliable information. But when you see all of this new stuff, nobody else knows it, then it's something to it that is probably not right. And they'll say something that's a little bit correct, but take you down this path where it's like, oh, I'm the only person that knows the real truth. well, that real truth is not true. And so,
Exactly.
you know, and one of the things about science is that we know it has to be, you have to be able to repeat it. And if you can repeat something and make sure you can, as we say, validate it. But when you can't, it changes. And so if today one thing is, you know, we thought years ago that smoking was good for you. Well, we find out later it wasn't. Now we have to change with when we find out new information, we make those changes. So don't say, well, once y'all said this and now you're saying this, you know, you change it based on the science, based on the evidence, and make sure that when we're smart people again, and use your common sense. Common sense says don't go out in a big crowd. Don't do it. It doesn't matter if somebody says, yeah, it's okay, or if somebody, you know, some politician says it's okay not to wear a mask. You got common sense. You wear your mask. You do what you know is right. And don't forget that little gut feeling is worth something. It's protected us, as particularly as African Americans, throughout the ages. We know the basics of right and wrong and stick to that. You know?
Yeah, and just so everyone will know, again, the Zillow website is www.zillow.com/resources/stay informed. It's zillow.com/resources/stay informed. And to your earlier point, Dr. Benjamin, I saw a mind-boggling statistic. 10 deadliest days in the history of America, and that includes terrorist attacks, wars, etc. 10 of the 10, 7 were recorded because of the coronavirus. What does that tell you, or what does that tell people? What should that tell people about this vaccine? And speaking of the vaccine, again, Dr. Benjamin, some say, well, I take the flu shot and I still get the flu. I take this vaccine and I still get that. What do you say to them?
So I'm going to answer that first one, this last one first. When people tell me, well, you got the flu, yeah, but you didn't die. We're protecting you from the ones that died. I mean, and when people say, well, you know, if I get COVID, can I, you know, am I immune forever? Do I need the vaccine? Yes, you do, because just because you get a cold don't mean won't get another cold. We don't know. And so this is a very new virus, so we're still learning. You want to, even if you had COVID, you still might be able to spread it. So you want to get the vaccine anyway. And some of those are excuses that people make, and I'm not sure why they make these excuses. But take the vaccine and don't talk about the fact that it made you sick. It kept you from dying. So you're gonna. Some people will get some kind of reactions, like I got my flu shot and my arm was sore for a day or so. That means it's working. But you know, it's supposed to have a reaction, an immune response, and so some people's immune response is a little stronger than others, but it kept you from dying.
Yeah. Well, we got a couple of minutes left. We certainly want to thank Zillow so much for putting this together for us. And I'm going to turn it over to Dr. Chavis, our president and CEO, for these remaining couple of minutes. Dr. Chavis, I'm sure you have a whole lot more to say, but we know we only got a couple of minutes.
Well, you know, first thing I want to say is, again, thank Dr. Regina Benjamin, distinguished healthcare leader, distinguished medical authority. We thank you for your leadership, and we thank you for you're still on the front line. And we really appreciate the fact now that you're working directly with Zillow, the nation's largest real estate company, to ensure home safety and health. And I want to just pledge on behalf of the Black press that we will continue to engage with you. We thank you for being a part of our coronavirus task force. I think today's information that you've given out, Dr. Ben, has been encouraging. It's been factual. It's based on science. And I think that we've given out good information. And before we close out, Stacey, give out the website again so people can go to get the information from Zillow resources. But I just want to say the closing remarks, Dr. Benjamin, words of gratitude. Our chairman of our board, Karen Carter Richards, just got a text from her. All the publishers are very grateful for your leadership and grateful for all the work that you continue to do.
Thank you. I just want to make sure that you understand that I'm advising Zillow, which has been wonderful, but it's just part of what I do. I mean, that's just a small part. I still have my clinic. I still have to do everything else. So if I can be of any services on Zillow or any of the other things, just let me know.
Absolutely. We're going to continue to work together. But thank you so much. This has been a great program this morning, giving out a lot of details, a lot of facts. And we want to make sure now we take this content, states, and distribute it widely, not only to African Americans, but to all Americans. And actually, the gift of internet is that people around the world will also see this program.
Absolutely. And again, as we close out, that website for all of Zillow's COVID-19 information is www.zillowcom/resources/stay informed. So go there and be informed. And thanks again, Dr. Regina Benjamin, the great former U.S. Surgeon General, and of course, our president and CEO who makes it all happen, Dr. Benjamin Chavis. Everybody stay safe and stay well and listen to Dr. Benjamin and folks like her.
Thank you.
Thank you.